Hi, I'm Judith Miller with the Newtown Chamber of Commerce. Thank you so much for joining us for our community discussion about COVID. I'm joined here today with Dr. John Murphy with Nuvance Health, and we have Dan Rosenthal, our first selectman, Donna Colbert, our Newtown Health Director, and Matt Arenello with the Community Center, Director of the Newtown Community Center. Dan has been working very closely with Dr. Murphy regarding COVID and keeping each other up to date about what's going on in Newtown, and Dr. Murphy giving us some of the most current information about COVID. So Dan, if you could tell us a little bit about what you've been doing.
Sure. Thank you, Judith. And thank you to the Chamber for hosting this, to Dr. Murphy for joining, and of course to Donna and Matt for being on here as well. I think it's probably one of those things where I don't know how much help we gave to Dr. Murphy. I think it's more the other way around. But certainly whenever Donna or I had questions, Dr. Murphy was certainly ready, willing, and able to have a conversation with us. And we are fortunate to have John as a town resident. He's always been, I think, lent an ear to us, but Danbury I should say Nuvance now, has always been, I think, very supportive to the Newtown community, and I'm thankful for that. Governor Lamont, some months ago, I think it was probably 2 months into the pandemic, made Dr. Murphy a member of his advisory council. And I think that was probably one of there's been a lot of challenges thrown at the governor, but I think that was certainly a good decision on his part to involve John in that. I think John has a very steady approach to things. And certainly when we've reached out on the COVID front with questions, he's been able to give a lot of guidance, direct taking. I remember before the vaccines were actually rolled out, having a conversation with John on the vaccine front. So certainly a great person and a great person to involve today in this discussion. So thank you.
Thank you, Dan, and thank you, Judith and the Chamber, for inviting me. And it has been a pleasure. And certainly I'd like to also compliment Dan and Donna for the work that they've done through the pandemic. I have had the pleasure of speaking with Dan on a number of occasions, and Donna as well. And I will tell you that the town has been led very capably throughout this. I think Dan has been steady and measured and well-informed, asked great questions, and didn't hesitate to reach out when he felt that there might be something that I could provide in terms of information or guidance. And as he said, I have worked closely with the governor. I've appeared on a number of occasions with him at press conferences and meet with his team on a weekly basis, and have since March, and more recently with the Commissioner of Health as well, to go over not only the COVID-19, what are we seeing on the ground, but also to plan and execute the vaccination strategy. So it's a pleasure to share my perspective with you and take your questions. I thought what I would do is maybe just go through a few things. Firstly, what is the current state of the COVID-19 illness burden in the community, and specifically at Danbury Hospital? As you may know now, Nuvance Health, we have 7 hospitals in Western Connecticut and in the Eastern New York and the Hudson Valley. But I'll focus my remarks largely around the Danbury experience. I then cover the vaccination efforts, what we're doing in concert with other partners in the community. Talk a little bit about vaccine efficacy and safety. Now that we've been able to administer millions of doses, what have we learned? Do they work, and are they safe? And then cover a little bit on what about these variants that we keep reading about? How concerned should we be? And then maybe a prediction about when will we get back to normal. And unfortunately, I see this is being recorded, so I could actually be held to what I'm about to say, but I'll give you a perspective on what might happen later this summer, and then take questions to the extent that you have any. So looking back at the pandemic, it's really just been almost a year, actually 50 weeks ago, we admitted our first patient. I remember it was a Friday night, and we thought, wow, this is a sick patient. And I do actually remember the team commenting when we got the patient to the ICU with all of the care the individual required, that we thought at that time we could probably handle 3 such patients at any given time, given the intensity of the all hands on deck that were required. Little did we realize that he would be the first of 1,500 patients that we have cared for. We're just coming up on the 1,500 mark at Danbury Hospital. We have treated more than 5,000 across the network. And let's be clear, we've gotten used to it, but it is still a lethal, or can be a lethal disease. It is still claiming more than 2,000 American lives every single day. And we are approaching the grim milestone of 500,000 deaths in the United States from COVID. And as you probably have read, that's more Americans have died of COVID than did in the world wars and the Vietnam War combined. In Connecticut, we've lost over 7,000 people tragically. And at the present time, we now have 35 inpatients at Danbury Hospital. We have seen a steady decline over the last really 2 to 3 weeks. We've been pretty busy since just before Thanksgiving. But 35 patients, I mean, it's a lot, but it's not like it was in mid-April when we had 165 patients in Danbury at the same time. Typically, when you walk through the ICU in Danbury, you may see 10 or 12 patients on a ventilator. There were times where we actually were running 3 full ICUs in the hospital, converting many other units specifically to ICUs. And we had every ventilator we could find occupied. Just to give you a perspective on who gets sick, I would say that our experience has been 80% of inpatients have been over the age of 55 over the past year. And that's true across the country. 92% of all the deaths in the United States have occurred in people over 55, which is really why we have been so focused on vaccinating the elderly first. 10% of the inpatients this past year have been under the age of 44. So it doesn't exclusively occur in those over 55. It has affected and even taken the lives of people quite young, including in their early 30s. The mortality rate, and we have lost 175 patients here at Danbury Hospital since the pandemic started, tragically. The mortality rate was pretty high in March when patients first came in. We had never seen, no one had ever seen this virus before, and about 1 out of 5 patients was succumbing to the illness. We were ventilating about 1/3 of the patients who came in, putting them on mechanical ventilators, which was, the right thing to do at the time. And typically they were staying for 2 weeks. I will tell you, and there's no political agenda here, that some of the information that we were listening carefully to that was coming out of China early on turned out not to have been terribly accurate, at least from our perspective. Their patients were staying 4 weeks. Our patients, even back in March, were typically staying 2 to 3, more typically 2. Now we turn patients around for the most part in under 7 days. They get back home, which is terrific. And the mortality rate is now in the single digits. So even if you get to the hospital, you have a better than 90% chance of leaving the hospital. And why is that? There are a number of reasons. I think, firstly, we have much better testing. So we know who has COVID more quickly than we did. You remember back in March and April, we were a little clumsy getting the testing strategies and even the testing equipment rolled out. But again, I think that Dan and Donna did a great job in Newtown, and they were as fast on the mark as anybody was. We also have now, when we identify somebody who is tested positive, we have available to us monoclonal antibodies, which we didn't have through the spring and even in the summer, pretty aggressively to try to preempt the disease. And those were the therapies, for instance, that President Trump got when he tested positive. We are using that across the network quite aggressively. There are also, if you do make it into the hospital, we have proven therapies. There are 4 things we do for most patients now. We use remdesivir, which we know works. And it's better if you're in the hospital. We're not so sure it works yet on the outpatient environment, although we are testing that. We also use, again, this came out of China, I think incorrectly, saying that steroids didn't work. They in fact do work. Particularly for people who have low oxygen levels, they are tremendously effective. So we're using Decadron or dexamethasone. We're also anticoagulating people. We didn't fully appreciate early on the propensity of patients with this disorder to form clots, many of which actually were life-threatening. So now patients are regularly anticoagulated as soon as they come in. And then we're also using, through the good graces of people who have had infection and donated plasma, we are using convalescent serum, which is rich in antibodies against the virus. And we have been very liberal and very fortunate. We did a study with Johns Hopkins very early and were able to collect a great deal of serum. And we're now providing that to patients with infection. And as a result of that, mortality rates have fallen by more than 50% from where they were in the spring. And I can tell you that our mortality rates, even though it was tragic that we've lost 175 souls, our mortality here is better than when we compare ourselves to like hospitals. Risk-adjusted mortality in Danbury is significantly better than it is across the country. The other thing we're doing differently now than we did in the spring was people were coming in, we were watching them get hypoxic, really running short on oxygen, and we were intubating them and putting them on mechanical ventilators. We found actually that should be reserved for the most severe cases, and we're now actually delivering oxygen through high flow hoods, and we're also turning people onto their stomachs, which is something that we learned to do well, and that too is saving lives. In addition, if you look out in the community, the positivity rates have fallen by about 50% just in the last month or two. And truthfully, we're not exactly sure why that is. We're delighted that that's the case. I looked up some of the Newtown stats, and I'm sure Donna knows these much better than I do, but the number of positives has fallen pretty steadily, which is great. I think perhaps it's because there are fewer gatherings. You know, we're past the holidays and past the New Year's Eve parties. The Giants weren't in, so there weren't a lot of Super Bowl parties in town, or the Patriots, I guess, although the Brady fans were still gathering. And then, of course, increased immunity. We have, fortunately, lots of patients, including many in Newtown, who are able to get vaccinated and are eligible, have lined up, which is terrific. And I also think, actually, more people are wearing masks now that perhaps there is a clearer value that's been expressed and demonstrated. For all those reasons, I think transmission has gone down. Turning now to the vaccination efforts, I think that certainly the town of Newtown has done a great job. We in Danbury have a number of sites. We're now at about 1,000 patients. We're trying to get to 1,000 patients a day throughout the hospital. And we have administered 45,000 doses thus far. The rate limiting step at the moment really isn't capacity, it's supply. And I know that Donna and Dan were telling me the same is true in town, that it would be great if we could get more. And certainly Pfizer and Moderna have promised that they will be producing more. And hopefully we'll have a third vaccine next month that will be available. But we are anxious about two things. Once the supply increases, and then once we move out of phase 1B and move to individuals between 16 and 64 who have 2 or more comorbidities, we think the demand will actually spike well beyond what it is now. We, just so you know, to the extent it matters, feel that the hospital will not be a mass vaccination site. We need a site that has a higher throughput. I was on the phone this morning with the mayor of Danbury, and I'll be on the phone tomorrow with state officials and working with CHC, the FQHC in town, to try to move to the Danbury Mall so that we can do a much better job of moving more people through the same site in a given day. We think that will be an important part of the solution going forward, and obviously staffing it and putting all of our resources together to get as many people vaccinated as possible. And just a word, in case you're wondering, hey, what vaccines should I get? Which ones are good or which ones are available? And what about the technology? Do you think they're safe? I will say that, yeah, they really are safe and they are effective. The notion that we got 2 vaccines available and approved that went through phase 1, 2, and 3 trials in less than a year is really remarkable. The type of vaccine that is approved now, it's called an mRNA vaccine. I can go into the science of that if anybody's interested, but it's a fairly novel vaccine approach, although the technology of using mRNA has been available and studied for about 30 years. This is the first time they actually got the sequence of the virus, which was made available in January, and they actually plugged that sequence into a chassis, which is basically an RNA, which is a series of blueprints that are delivered into the cell, and the cell sees it and says, okay, it's time to start making this spike protein. When the spike protein gets released by the cell, mind you, it's not the virus, it's just the little spike that sticks on top of the virus. The body sees that spike, makes antibodies, pretty robust production of antibodies, so that if the real virus ever were to appear and those spikes were on it, the body would instantly recognize the spike as foreign and eliminate it. The good news really about both Pfizer and Moderna is that they are remarkably effective. To put that into some context, the flu vaccine, which I hope many of you get, is typically anywhere between 50 to 60% effective in a given year. This is 95% effective, both of these, against all forms of the disease, be it mild, moderate, or severe. It's important to know that it is 100% effective against severe disease. Severe disease is the kind of disease that gets you into the hospital and or kills you. So what is so remarkable is if you get the vaccine, that is effectively taken off the table, and you have a 95% chance of not getting any symptomatic infection. 2 doses are required for each of these, either 3 or 4 weeks apart, depending upon which vaccine you get. One of the limitations, truthfully, of the vaccine, despite all of the incredible effectiveness that I've just shared with you, is that you have to have ultra cold chain storage. You have to have a freezer that gets down to about minus 80 degrees centigrade, which is why it's not widely available in your local doctor's office, and until recently some of the pharmacies, is because you need to be able to store it. And then once taken out, there's a limited availability. It expires after several hours of having been thawed, and certainly Donna and team are intimately familiar with these requirements, but it is a limitation. Another question that I think is worthy of some discussion is, well, who they tested on? Because, for instance, there was a study that came out in the last 5 or 6 days out of Israel, which is an interesting study and potentially an important study, looking at just giving one dose as opposed to 2 doses. The caveat that I would offer, though, is that who got tested? It involved 9,100 patients in the Israeli cohort. In the United States, in the trials that led to the approval here, there were 40 to 50,000 people. Half of those individuals were women, half were men. 37% were people of color, so we know it works in communities of color. 20% of the vaccines tested in the critical trials were given to people over the age of 65, so we know it works in the elderly. In addition, we know it protects even in people who have diabetes or obese or have high-risk comorbidities. So it was broadly sampled, and it was 95% effective in that cohort, which is very reassuring. So then the question really is, how safe is it? And I'll tell you, I've had the good fortune, as a doc, I still see patients from time to time. I was in the first wave, and I did have a local injection site reaction, but honestly, it wasn't very different than what I get with the flu. I did have a little bit of headache and a little bit of fatigue. It didn't keep me from work, and headache and fatigue have been seen in a handful of patients. Serious adverse events were not reported. Truthfully, serious adverse events occurred more frequently in the placebo recipients than in the vaccine recipients. You have read perhaps about the anaphylaxis or the anaphylactoid reactions, and it looks as if that does occur in about 4 per million recipients, which is why we ask people to stick around for 15 minutes after you receive the dose. Anaphylaxis, we can treat rapidly and effectively, and that's why we want you to stick around. So if it happens, we can deal with it. But I was listening to a vaccinologist speak, and I tied into a lecture series to try to stay current on this. And every weekend I listened to a series of lectures. And this was the fellow who brought several vaccines to the market over the last 30 years. And what he said was he never breathes a sigh of relief until at least 3 million vaccine doses have been given. Then he and his team take a deep breath and say, okay, so what have we learned? Because by 3 million doses, you really have exposed enough people to pick up fairly weak signals, but real signals about risk. And you have to remember now that we've vaccinated, we've given more than 50 million doses in the United States alone. And to the extent that anybody wants it, there is actually a searchable database open to the public. I searched it myself this weekend. So the US and the FDA have been very transparent, not only about the approval process, about the data that they reviewed to grant emergency use authorization, but also in terms of the side effects that have been described. So those are the mRNA vaccines, and that's Moderna and Pfizer, 2 doses, ultra cold chain storage required, and very effective. Let's talk a little bit about the DNA vaccines, which are pretty similar, but instead of producing, giving the body messenger RNA, these are actually given viruses that have been tamped down so that they're not infectious, and inserting into those viruses little snippets of DNA that do the very same thing. They code for the spike protein. So they're introduced, and the host is another virus that's attenuated and does not have the ability to reproduce. But they come into the body and they start producing the same thing, the spike protein. So those are J&J. J&J has actually teamed up with Janssen, so you may hear either of those names. And the second DNA vaccine is the AstraZeneca/Oxford vaccine. So let me talk a little bit about those 2 vaccines, if I could. And a couple of key points. The J&J vaccine, they applied to the FDA on February 4th, just 2 weeks ago, and said, hey, listen, we've got some good data. We want to share it with you. And they have a meeting this Thursday, and they will present all of their data to the FDA, and that data will be made public and can be viewed. But it was released, at least a good bit of it, in a press release a couple of weeks ago. And the good news there is, once again, what you really want to know, I think, if you're getting a vaccination is it still, could I still end up in the hospital? Could I still die? With both J&J and AstraZeneca, the answer is no. It's 100% effective. Both of these vaccines, 100% effective against severe illness or death. Now, the J&J vaccine actually also included a different outcome, and they said less severe disease. And the way they measured that was if your oxygen level falls below 93, it was less severe. It was 89% effective against less severe disease. And this is true in South Africa. And the reason I'm making this point, it was virtually 90% effective against either severe or less severe disease in South Africa, where 95% of the virus that's present in South Africa is the South African variant. And we're going to be talking about that. So these vaccines are effective against severe disease in the common wild variant as well as the South African variant. What about mild disease? And again, mild disease, I don't want to trivialize it, but it's mild disease. It's the equivalent, could be the equivalent of a cold or a flu. And the J&J vaccine in the United States was 72% effective against mild to moderate disease. The nice thing about J&J is it's one dose. For AstraZeneca, it's 2 doses, taken a couple of months apart. But once again, these vaccines were tested in a demographic that is useful for us in that half for men, half for women, 45% were Hispanic, 20% were African American, and in these trials, 41% had comorbidities. You can store it in a refrigerator for a couple of months. I suspect that, I hope the FDA will study this on the 26th, and within a week or two, approve it for emergency use. So we may be seeing a third vaccine available in mid-March. The AstraZeneca vaccine has already been approved in the UK and in India, and I believe in Argentina. What's interesting about that, now that got pulled back in South Africa, and it was exchanged for the J&J vaccine because it wasn't quite as effective in protecting against mild to moderate disease. Interestingly, however, it is effective, it appears, in preventing transmission. That wasn't really carefully studied in the in the Pfizer or the Moderna vaccine, but the AstraZeneca trial was designed in such a way to look at 2 things. Hey, am I going to get sick? Or B, is it possible that I could still have an asymptomatic infection and transmit it to somebody else? The AstraZeneca vaccine appears to prevent transmission. Whether or not the Pfizer and Moderna vaccines prevent transmission, meaning asymptomatic infection that is unknowingly passed on to somebody else, that is currently being studied, and that is still an open question. It is thought to be unlikely based upon some studies on viral loads in the nasal mucosa, but be that as it may, it is still an open question. Just a word now on the variants. There are 3 variants that you've probably heard about. One is the UK variant, and that is now present in 39 states in the United States. Variants occur because of mutations. And what happens is this virus is an RNA virus, and there are 30,000 letters that make up the RNA strand. And it gets copied as it replicates. And when it's copying itself to a new virus, it makes a mistake. It makes maybe 20 mistakes. And this new virus doesn't look exactly like the parent, and it's called a variant. And now there are plenty of variants, and RNA viruses do this all the time. They regularly create variants. If the variant is sufficiently different than the parent, and it behaves in a different biological pattern, it's actually called a strain. It's a new strain. We're not talking about strains here. We're talking about variants. It's still basically the same virus. But the UK variant is more transmissible. It's probably 30 to 40% more transmissible. And the reason is it sticks to the mucosa in a way that some of these variants, some of these mutations make it stickier to the mucosa, to the binding site. As a result of that, it's conceivable that it actually may be more lethal. I think the jury is still a little bit out on that. But the good news is the vaccines are very effective and produce high degrees of neutralizing, actually even sterilizing antibodies against UK. So it will spread, it will become more prevalent, but it is not going to be a problem. It will not escape these vaccines. The South African variant is now present. You may have heard this. There was a patient hospitalized last week in New York City. And that individual was actually a Connecticut resident. There are 8 other states, I believe, in the United States which have reported the South African variant. The vaccines may be less effective in protecting against mild to moderate disease. There is no evidence that the vaccines will provide less effectiveness or less protection against severe disease. But we're going to have to stay tuned for that. Then there is a Brazilian variant, which is very similar to the South African variant. And I won't go into any details there, except to say there was a case in Maryland recently reported. But these are not unusual. It is important to realize that the vaccines protect against severe disease, even with these variants. And the important message that I'd like to leave you with on the variants is, in order for the variants to be produced, they have to replicate, because they can't mutate unless they're replicating. So the way to get ahead of them really is to stop transmission. And by the way, with these variants, we are sequencing them in the state of Connecticut on a regular basis. Every week, viruses or samples or people who test positive, we are looking carefully at, the state is, at whether or not they contain these variants. Already the companies are creating new vaccines to the extent that these become a problem. They will create a booster dose such that people who have been vaccinated, I don't know, maybe 6 months from now would need a booster dose that would be engineered in a way to be uniquely responsible to these new variants and the mutations that they carry. Because mRNA and the DNA viruses, the vaccines rather, can be engineered pretty quickly and modified to address whatever mutations are present. But the best strategy is to stop transmission. And how do you do that? Well, you wear a mask. And you may have seen or heard that the CDC recently came out and said, hey, maybe you should wear 2 masks. And I want to spend a moment or two on that, just to share with you some of the current thinking on that. And because even though the vaccines are here, we're going to be wearing masks for a while. I think Fauci said on a program this weekend that we may be wearing masks for the rest of the year. But a couple of points to make. As you're thinking about mask wearing, consider a couple of things. One is who are you with? Meaning, are they vaccinated? Are you vaccinated? So what about host susceptibility? But also the distance that you keep is important, and whether you're inside or outside. Ventilation is incredibly important, which is why I do think when the summer comes, or maybe late spring, when we're all outside more and maybe eating outside, I think transmission will continue to fall. But when it comes to mask wearing, and we still, I've been vaccinated, I still wear a mask. I'm sitting in my office right now by myself, so I'm not wearing it. But when I'm out and about, I wear a mask all the time in the hospital, as does everybody who works here, have to wear a mask all of the time. But 2 things, fit and filtration are important. So if you're outside, by the way, if you're outside and you're by yourself, you probably don't have to wear a mask. But if you're outside in public, you do need to wear a mask. And you're outside, there's ventilation. A simple cloth mask is fine, or a surgical mask is fine. When you're inside, you can wear an N95 mask, although, and I've spent a lot of time in an N95 mask when I walk through the wards or in the ICU. They can be a little uncomfortable. They can be hard to find, and truthfully, we would prefer that they be reserved for healthcare workers who are being exposed to aerosolizing procedures. But there are other options. You can wear, if you're indoors, particularly as these variants come around. I was on a flight down to Florida to see one of my kids this weekend, and I was at JFK. I was wearing 2 masks. And it was a surgical mask, tight fit, and then a cloth mask, a multi-layered cloth mask over that. I was also wearing eye shield. And I think that's appropriate. That's one approach, surgical mask plus a cloth mask. Or my wife chose a cloth mask with a filter in it. And those are both perfectly reasonable. But I do take seriously the notion of masking when I'm indoors, and I would ask you to think about that as well. And the other thing is, if you get a chance to get vaccinated, I would strongly encourage that because it's a it's a tough disease. I've seen lots of people with it, and it's very tough when your lungs get filled with fluid, I tell you. Just to last, finally, what about getting back to normal? When do we think that'll happen, and how will it happen? And you've probably heard about herd immunity, and herd immunity is when you reach a level of a natural immunity in the population that the virus basically has nowhere to go. And technically, it's measured by the transmissibility falls below 1, meaning an individual who gets infected doesn't infect anybody else, or on average, infects fewer than one individual. When the virus first broke, its infectivity was about, for every individual who got infected, he or she infected 3 to 4 other people. And it has come down now that we're better at mask wearing and physical distancing, et cetera. But we think that about 60 to 70% of the population needs to be immune to basically put the virus in checkmate so that it really can't prey on other individuals. Now, some people say it's actually 60%, and there is a formula. I won't bore you with it, but some of it is dependent upon how effective is the vaccine. The higher the effectiveness of the vaccine, the lower actually the percentages that you need for herd immunity. So let's say it's 70%. That means we need to have about 225, 230 million Americans immune. Now, you can get immune one of 2 ways. You can either get it because you've been infected or because you've been vaccinated. So let's just do the math there and think about this. It's pretty clear that we know now, as of this weekend, 28 million Americans have been infected. They've tested positive. Now, that means that there are 28 million people who have immunity, at least for some period of time, and we don't know how long, but it appears as if, given the rarity of reinfection, that it's probably at least a year. But we also know that there are many more people that have been infected than know they were infected by virtue of antibody studies. We actually think that there are at least 2 people who've been infected and didn't know it, as there are people who know that were infected and tested positive. So a very conservative number is you ought to say, we've got about 100 million Americans who have already been infected and have some degree of what we call native immunity. So that's a good start. And then if you look at the vaccines and say, okay, so we need to get another 130, 150 million Americans vaccinated. So far, we've given 66 million doses in the US as of this weekend, and 19 million Americans have been fully vaccinated. So let's say 20 million. So we need another 100, maybe 120 million Americans to get vaccinated. And right now we're going at a clip of about 1.7 million vaccines or doses per day. So I think that actually, midsummer, we could be in good shape. We could be mid-July. I realize this is being recorded, as I say, so don't hold me to it. But I would be hopeful that if we could go, say, in 4 or 5 months, I think we could be in a very good place. Now, what could change that? Well, if the variants come out and they appear to be a problem by virtue of greater transmissibility, we'll have more native infection. If for some reason the government decides to roll back physical distancing or let go of the mask mandates, that could be a problem, and we could pick up on the transmissibility. And on the plus side, if the J&J vaccine gets, the supply is going to increase considerably. And instead of vaccinating at a rate of 1.7 million doses per day, we could be up as high as 3 million doses per day, which would be terrific. So there are lots of variables there, but I do think that help is on the way and there is a light at the end of this thing. So some of the messaging that maybe I could share with you and test your thinking on is that I think the public is savvy enough to understand this. Certainly the Newtown community is. I think we do have to deal with some of the vaccine hesitancy. And I would encourage people to think about some of the mask wearing mandates in a couple of ways. One is, I think you have to realize that, and I think the CDC is going to be coming out with this shortly, that if you and your family are vaccinated, and you're talking about vaccinated people mingling with vaccinated people, there are no restrictions. You can take your masks off, which is, I think, terrific. If vaccinated individuals are around unvaccinated or the public, you do have to keep masks on and you have to maintain distancing until such time as we know that vaccinated people can't transmit unknowingly to the unvaccinated. And what about unvaccinated people being around unvaccinated people? Well, all of the present restrictions will remain in place. I mean, that's just a fact, and we've got to do that. But I think we should be optimistic, and we should give people reasons to either, go get vaccinated, because I think that there may come a time where those are the people that can travel freely. Those are the people that can get certain jobs. Those are the people that can get together with their family and visit their loved ones and give a hug. So I think we need to promote vaccination as a healthy, optimistic thing to do, and try to meet people where they are with respect to their hesitancy and work with them. But I do think by mid to late summer, we're going to be in a much better place. I do think the mask wearing, though, is probably going to be with us through the fall and maybe into the very end of the year. So with that, perhaps I'll stop here and invite your questions, or Judith, if there are areas that you want me to cover that I didn't, I'd be happy to address them for you.
Excellent. Thank you so much, Dr. Murphy. That was wonderful information. Matt, did you have a question?
Sure. Thank you, Judith, and thank you to the Chamber for hosting this event. Thank you, Dr. Murphy, for joining us today, and we are so appreciative of the support of Nuvance Health and collaboration here at the Community Center. One question that came up after the presentation was, how long after the second dose are you protected?
That's a good question, Matt, and thanks for all you do at the Community Center and for your work with the town. The evidence is about a week or two after your second dose, you have achieved maximal immunity where you get to that 95% dose. And it's pretty clear that immunity continues to climb until about 10 to 14 days after the second dose.
I have another question as well. There's been some hesitation from those looking to plan a family. Has there been any studies around those who are pregnant or looking to start a family about being vaccinated?
Yeah, that too is another very good and important question. There has been some, I think, rumor and a bit of unnecessary fear around this, that somehow it may impact fertility. And it isn't true. And if anybody wants access to some of the videos that I have, there are, the American College of OBGYN has come out on this and stated clearly that these vaccines do not impair fertility. I do recommend, as does, I believe, the CDC, for pregnant women to meet with their physician to discuss it. But I'll also tell you that COVID has the ability to make a pregnancy more difficult. We have certainly seen that here. Vaccination will allow the antibodies to cross the placenta into the fetus, but there is no reason to believe, there's no biological reason to believe that it interrupts or impairs fertility in any way.
Great. And the last question I have, I know there's been many lessons learned during the pandemic, but what is one lesson that you think will shape medical care in the future?
Yeah, Matt, it's hard to give you a single answer on that one. I think I've learned, we've learned several. One is the importance of protecting the workforce. I mean, this is, I remember one week, it was a frightening week in late April where we had 4 employees on ventilators themselves, despite the fact that we fought very hard to find PPE, and we never asked and never had an employee go into a room without proper protection. But it is a tough disease, and we've been on the front lines for 350 days here, but we will continue to be cognizant of doing everything possible to protect our workforce. We'll also, I think the mistake we made that everybody else made, I think every other health system was, our inventory was this notion of just-in-time inventory. We had just what we thought we needed. And now we are renting space and filling those spaces, those warehouses, with a minimum of 90 days supply of necessary PPE. I think we also recognize that this virus exposed some of the healthcare inequities and disparities. We've got to do better at reaching out to the communities of color who were hit harder by this. We have to do a better job actually in getting those individuals vaccinated and protecting them. And then lastly, the other thing we realized is that telehealth and virtual visits and connecting inpatients to their families through virtual communications, those are effective strategies that even today, almost a third or at least a quarter of our visits in the medical practices are now done virtually. And that infrastructure is now in place. And to the extent that we're confronted by a third wave or another pandemic, I think we'll be in a much better place to deal with it.
Great, thank you. And thank you for your time, and thank you for all your staff has done during the pandemic.
Thank you, Matt.
Donna, did you have any questions or any input from what you've been dealing with in the community you'd like to add? Just
Hey,
1
Donna,
minute.
you're on mute.
We'll unmute you.
Thank you. Yeah, a couple of things. I think it was really good to hear from Dr. Murphy, because what we're experiencing here in Newtown, is pretty representative of what's happening, I say, in the region. Our case numbers are gradually coming down, which is reassuring. And the people that we speak to when we do case follow-up or contact tracing, in general, I would say people are less severely ill than they were last year or in the spring. And that's, and not that I want to make light of anyone's illness, because there are people who certainly struggle with the virus. And, we have great systems in place here in the town, as well as, neighbors and family and churches and everyone who helps support each other. So, I feel, we're really well supported in the community. But it's a better feeling that the numbers are starting to go in the right direction. People do appear to be less severely ill. And, vaccination is on the way. We're certainly working our way through that. Our allocations, as Dan had said, aren't certainly not going to meet the demand. How many people want to be vaccinated. I feel that we don't have that much of a hesitancy problem here so far. I mean, it's early, and we know that we're taking care of our most vulnerable residents, so that's good. So I'm feeling pretty good about that. I think I agree that people really, and they have been really keeping up with all the precautions that need to be in place to keep the virus at bay, because this is going to take a while. And I think in general, people are doing really well. The residents do well. I think our businesses have been phenomenal. Just pretty much, all our community partners, I think everyone's just really keeping up the good work. It really makes a difference. And I think we're seeing that. But I think the big thing, and, our perspective here in the community is certainly probably different than at the hospital, but it's trying to strike the balance. People are certainly struggling with COVID fatigue, and now we have winter fatigue, and there's not that many exciting things that people are looking forward to for a little while. But we're getting there. We're definitely getting there. And if people can feel the they need to take to protect themselves and their loved ones, and still being able to enjoy their lives, there's still things that people can do, and they need to make sure that they're engaging in whatever way they can and reaching out in whatever way they can so that they don't feel the weight of it all. I think there is a lot more light. There's certainly a lot more light at the end of the day now, in the beginning of the day. So we're getting there. And I'm hoping that people can remain optimistic because I'm feeling it. I see it. But it is going to take a while, and I'm hoping people can be patient. As Dan had alluded to, as the different layers of the different phases for people being eligible to get vaccinated open up, it's still going to take time. And so I'm hoping that people will just, keep it up and be patient, and we will get there.
Thank you. Thank you so much, Donna. Dan, did you have anything you'd like to add so we can wrap up here?
No, thank you, everyone. John, as usual, very, very enlightening and very methodical in terms of your approach to all this. So, if we haven't been dealing with a lot here, I know you've been dealing with an extraordinary amount, managing a health network. So I appreciate your contributions to the state and your insights. And I look forward to putting this behind us, but I know everything you're doing is going to help for that to happen sooner rather than later.
Well, thanks, Dan. And I do, again, want to commend you and your team. When I get those phone calls, the emergency communications, they're always, I think, appropriate and timely. And there's a measure of calm, which I think is terribly important. And I think, just as Donna said, shifting towards optimism, as you have done, I think realistic optimism is terribly important. And I think with your continued leadership, I think the town's going to do fine. I think it has done as well as certainly any of the municipalities in the state under your leadership. So I commend you, and to the extent that we can help you and the town in any way, we'd be delighted to do so.
Thank you, John.
Thank you all so much for everything you're doing to keep us all safe. Dr. Murphy, we really appreciate your time today and all the information. Everybody stay safe, wear your masks, keep your social distance, and hopefully we'll all be getting our vaccines soon. Thank you for your time.